Hey there, welcome to Crafting Tomorrow's Health Today, the podcast that delves into the latest and greatest in cancer prevention and wellness. This podcast is brought to you today by Cancer Help Desk, which is a 501c3 nonprofit organization committed to supporting people facing cancer with what they need, even if they're unsure of exactly what that is. Please note, the information provided in this podcast is for general informational purposes only and is not intended as medical advice. Consult with a qualified healthcare professional for any medical concerns. Hi, everybody. I'm your host, Deb Christensen. I am the Chief Patient Officer and co-founder at Cancer Help Desk.
And I'm Hilary Deskins, Clinical Engagement Nurse at Leo Cancer Care. It is great to be here, Deb.
Well, we're so glad to have you, and thank you for joining us. Today we're tackling a really crucial topic, and that is why people might tend to avoid colon cancer screenings. Colon cancer is a real big health concern. The dire facts are that it is the second leading cause of deaths in the United States.
But the good news is that getting a colonoscopy can greatly reduce your chances of getting colon cancer. Right now, the recommended age for getting a colonoscopy has just been dropped for Caucasians. It's gone from 50 to 45 years of age. And for African Americans, it's gone from 45 down to 40 years of age.
What is the reason behind that?
Because they're finding out that cancers are starting earlier. And I think a lot of it has to do with the Western diet, but cancers are starting earlier. And the earlier you catch this, the better chances you have. And so that it makes total sense to me. Yeah.
Yeah, exactly. So if we put it in number terms, if let's say 10 more people out of every 100 got their colonoscopies, up to 11,000 people could either dodge the risk of dying from colon cancer or getting it in the first place. So with such clear benefits, it's a bit puzzling to me why some folks might hesitate to get this life-saving check.
I know it sounds logical, but honestly, I think a lot of it is, you can boil it down to fear of the unknown. Because first of all, they've heard horror stories about the prep, I'm sure. They've heard horror stories about finding a cancer and then what it's going to cost them out of pocket, how it's going to take them away from their work, and the time that's going to be lost, and how it's going to affect their health care insurance premiums. And also, the other things, just the total loss of control. It's a terrifying situation for patients.
Yeah, to even think about. And you have some great expertise, having started a colon cancer screening program in the state of Kentucky and having such great success. Tell us a little bit about that.
Well, and I do. And the thing is that, I would want people to remember is that I'm a nurse, but I'm a patient too. And the key for us was, when scheduling people, we wanted to treat people the way we wanted to be treated. In other words, it's, the golden rule: do unto others the way you would have somebody do unto you. And so when we called a patient to get them scheduled, we'd spend as much time on the phone as necessary for that patient to understand everything that was going to happen, to the point that they felt 100% comfortable with what was happening and what to do and when to do it. We would give them answers to the questions they didn't even know to ask. Okay, for example, I always tell patients not to refrigerate the prep. And patients are told, when they get their instructions, refrigerate it. Well, the reason they tell you to refrigerate it is because it tastes much better ice cold. Honestly, Deb, it tastes much better ice cold. However, what they don't think about is that whenever you drink anything ice cold, your stomach will slam shut and not let it pass on through till it warms up to body temperature. It's a protective mechanism. And that's fine if you're drinking one glass. But if you're pouring ice cold on top of ice cold on top of ice cold, you're going to get that horrible, full, nauseating feeling that you get right before you might throw up. So if you can drink it at room temperature, even though it doesn't taste as good, it goes straight through your system. so that you can drink it faster. You're going to have faster results. You're going to get through it a lot easier. But back to the information. So we'll give everybody all the information they could possibly use. And then, and this is something my colleagues used to shake their head and say, Hilary, you're out of your mind. At the very end, every single patient was given my personal cell phone number. I know that sounds crazy, but when you give people all the information they need, and then on top of that, you give them 24/7 access for any questions they can't think, they can't think of at the moment and they have for later, it gives them that feeling of control again, to the point that they don't need the access. So, I mean, I only got a phone call about once every 2 weeks because people felt comfortable. They felt in control. The fear had been wiped away.
And they had a point of contact, which is so important. A couple of things you brought up that just really stood out to me was that, you helped people understand things that they didn't even know to ask. So anytime that you're faced with some of these life-changing events, you're so caught up in the emotional piece of it that it is difficult to even know what to ask. You don't know what you don't know. And
Yes.
to have someone like you on the other end of the phone, or one of our oncology nurses at Cancer Help Desk, to be able to help you to know what you don't know, be aware of that. And that's got to make so much difference. Like you say, put you back in the driver's seat, right?
It's the golden rule. You take care of people the way, we as nurses would want to be taken care of. And we need to know everything. And so does everybody else. It's just a mutual respect.
Mm-hmm. Yeah. Yeah. The how and the why. Why to drink the prep at room temperature makes a lot of sense. When you first told me that, I was like, I'm sure going to try that the next time. And another thing that you had mentioned earlier before we came on the podcast was that you tried all the different preps, so that you had a empathy for the people that you were talking to, that you knew what you were talking about and you could talk about it clearly.
Absolutely. Well, there's to me, it's just so frustrating to have a nurse or anybody explain instructions to a patient when they themselves haven't gone through it. It made no sense to me. I wanted to know what my patients were going to go through, because and that's actually how I found out about the refrigeration. Because the first time I drank the prep myself, it was refrigerated. I threw up all over the place. And then and I can't remember how I learned about it, but somebody had said, don't refrigerate it. And I looked because I thought it had to be refrigerated. It didn't have to be refrigerated at all. And there was at one point when I had a pharmacist as a patient, and oh my goodness, he argued with me. And he said, well, it has to be refrigerated. I said, I'm telling you from someone who knows. I tell you what, try one part of it refrigerated, one part of it not refrigerated, and just get back with me. And after the test, when I called him to check up on him afterwards, he said, I will never again tell anybody to refrigerate that prep. So it's worth finding out for your patients if you can.
Yeah. I'm not sure I'd go that far, but I applaud your diligence and dedication. Hilary, you definitely do make colonoscopy sound easier, less scary. Thank you for sharing the incredible work that you do. Listeners, make those appointments and take that step toward better health.
As far as I'm concerned, here's to health and here's to taking action.
Absolutely. Thank you again, Hilary. Well, thank you for joining us on Crafting Tomorrow's Health today. We hope you found this episode informative and inspiring. If you have any questions or want to learn more about Cancer Help Desk and our personalized support services, please visit our website at www.cancerhelpdesk.org. And please subscribe to our podcast to stay up to date on the latest and greatest in cancer prevention and wellness breakthroughs. Together, we can create a healthier and happier tomorrow. Thank you for listening, and until next time, take care